I'm Dr. Chethana D. I'm a consultant rheumatologist at Aster CMI hospital in Bangalore. I would like to discuss about statins, which are a group of drugs that are used to treat bad cholesterol. So these are a group of very widely prescribed medications by different types of physicians, including general physicians, cardiologists, cardiothoracic surgeons, for example. Statins have a role in reducing the bad cholesterol, and thereby they will reduce formation of plaques or thrombosis or clots within the coronary arteries. The commonly used statins include atorvastatin and rosuvastatin. The way they work is by reducing bad cholesterol and prevent further complications, including cardiovascular disease and strokes. Statins are very well tolerated by most, if not all, people. Very minority of patients can experience body pains, which we call as myalgia. So apart from body pain, some people can experience muscle cramps, muscle stiffness, fatigue, for example. Most of these are very self-limiting and patients get used to these symptoms over time. But in a very minority of patients, some people develop very severe body pains or very severe myalgia. When you test their blood, one of the muscle enzymes called CPK could be elevated. If it's mild elevation, then it is not too bad. Some people can also develop a little more severe complications called as myositis, which is inflammation in the muscles, or even more severe condition called as rhabdomyolysis. So myositis, when I say it is an autoimmune reaction within the muscle enzyme which happens because of the statin. So the patients develop myositis. The symptoms would include severe muscle weakness in either their shoulder or the hip girdle. So they'll have difficulty in raising their hands above the shoulder or difficulty getting up from a chair. Now, if myositis is suspected, then we may consider doing a muscle biopsy and also some blood tests. The treatment for this would include immunomodulatory medications. Now, coming to the third, even more severe condition called as rhabdomyolysis. We hardly ever see rhabdomyolysis. The incidence is less than 1 in 1 lakh population. In rhabdomyolysis, there is very high elevation of the muscle enzyme CPK, and it can also cause kidney involvement, and patient may end up in ICU also if the case is very severe. The reason for this discussion is really for you to be aware of the possible side effects. Statins are to be taken very regularly if you're prescribed it for prevention of cardiovascular disease or the strokes. Now, if in case you're developing symptoms like body pain, then you need to seek help from your physician. Do not get very worried and stop it, but do consult the doctor. And if the doctor thinks it's a very mild body pain, then they may just ask you to withhold the medication for maybe a couple of weeks. And once your muscle pains are better, then you may be able to restart the medication. But if the symptoms are a little more severe, then we may altogether stop the statin and then give you an alternative statin or a completely different medication in order to reduce your cholesterol. If it's rhabdomyolysis, then we do not ever restart cholesterol lowering medication, that is the statin. Then the treatment for that would be symptomatic. Sometimes it includes supportive care like even dialysis. Now, rheumatologists come in picture when somebody develops this condition called as myositis. So this is treated by giving a course of steroids probably, and if it's more severe, then they would require some immunomodulatory drugs like IVIG. And sometimes another drug called rituximab, depending on the antibodies which are present when we do your blood test. Now, to summarize all of this, statins are an excellent group of medications which are used for primary as well as secondary prevention of cardiovascular disease and strokes. Some people develop body pains, some may develop even more severe muscle weakness. So if in doubt, please don't stop the medication. Do consult your doctor, and then if need be, it'll either be stopped or continued at a lower dose. Thank you.